Now let's begin with the introduction of our first speaker of the day. Here we have Dr. Miyuki Harada. So she's an associate professor of the Department of OBGYN of the Faculty of Medicine at the University of Tokyo. She is also a board-certified specialist in OBGYN, reproductive science, women's health, and laparoscopic surgery. Dr. Harada received her degrees, both her medical degree and her PhD, from the University of Tokyo, and her postdoc training included a fellowship in the medical school of the University of Michigan in the United States. She's a member of the ART Registry Subcommittee in the Ethics Committee of the Japan Society of OBGYN, and currently works on the revision of the guidelines for reproductive medicine in Japan. Welcome, Dr. Harada.
Thank you for your kind introduction, and a good afternoon, everybody. And let me share my slide. Okay, let me start with my presentation. And this is the outline of my today's talk. In the first part, I will share with you the current status of ART in Japan, and then explain the policy change as of April this year. And finally, I'll discuss the expected change and future perspectives in ART in Japan. And let me start with the status of childbearing in Japan. This is the total fertility rate. And as you can see here, we experience almost the total fertility rate with 1.3 for these 20 years. And in 2020, the babies born was, the number of babies born was 811,000, and it was the record low. And in 2021, almost the same, and it is suggested this year, it will further decrease. And on the other hand, 1 out of 2.9 couples worries about fertility issue. And the same survey shows that 1 out of 5.5 couples undergoes infertility checkup and or treatment. And this is the trend of ART cycles in Japan. Since the ART registry began, the ART cycle, the number of ART cycles is exponentially increased and keep stable for these several years, and still in a high level. And in 2020, the total ART cycle number is 449,900. And as a result, neonates born by ART was also increased. And in 2020, the 60,000 babies were born in by ART technique, and it accounts for 1 out of 13.9 babies born in 2020. And as you can see here in green part, almost 90% of the babies were born by frozen embryo transfer cycles. And one of the reasons of so many ART cycles in Japan is that the age of the women in ART cycles in Japan. As you can see here, that compared to the other region in the world, the Japanese women in ART are much older, and especially among them, 40% of them were is older than 40 years old. And this is the age distribution of the women in ART cycles into 2020. As you can see here, the peak age was 14 years old in total treatment cycles. And this trend is not changed for several years. Then I move to the main subject, policy change, as of April this year. Until March this year, all ART was conducted as private practice, and partially covered by national subsidy. The condition of coverage was the age of women at the first ART cycle was younger than 40 years old. Then she was covered up to 6 ED cycles. If the woman was 40 to 42 years old, then she was covered up to 3 ED cycles. And the subsidy was 300,000 yen per cycle, and it was around $2,100 US as of September this year. The age limits were decided based on the success rate of ART in Japan, where egg donation is not permitted. As you can see here, at 40 years old, the pregnancy rate for embryo transfer is around 30%, and live birth rate per treatment is around 10%. And at 43 years old, the pregnancy rate per embryo transfer is around 15%, and live birth rate per treatment was less than 5%. And after this April, ART became covered by national health insurance under the certain condition, which is same as previous subsidy system. That is, if the age of women for the first ART cycle was under 40, then ART is covered by health insurance up to 6 ED cycles. And if 40 to 42 years old, up to 3 ED cycles will be covered. And the subsidy was 300,000 yen per cycle. And under the national health insurance system, patients should pay 30% of the cost. So is all treatment in ART covered by insurance? The answer is no. The basic medication and technique is covered by national health insurance, but most of the add-ons are not covered by health insurance. And in our country, the health insurance system does not permit to provide medical care covered and not covered by health insurance at the same time. But some add-ons permitted as advanced medical care and medical care covered by insurance can be provided simultaneously in the health insurance system. So for our technique, prices are set for each technique, as you can see here. For example, for OPU, it depends on the number of oocytes picked up. And for TESEP, it differs whether it is the conventional TESEP or microdissection TESEP. And for ICSI and embryo culture and freezing embryos, it depends on the number of oocytes or embryos to treat. And for embryo culture, it also differs whether it is up to cleavage stage or blastocyst stage. And for embryo transfer, it differs whether it is fresh ED cycles or frozen soul ED cycles. And the artificial ovarian activation and assisted hatching and using medium rich in hyaluronic acid are all add-ons, but still covered by health insurance. These techniques are shown in orange font, like time-lapse and ERA, MR, and ALICE, and two-step. And these are admitted as advanced medical care, so simultaneously conducted with, can be simultaneously conducted with these basic techniques for shown in blue font. but PCT is acknowledged as a private practice. So let me show the two examples. And although these calculations are very simplified one, but still it will help us take image of this change. First example is 34 years old lady with male factor. She can pick up 10 oocytes, and among these oocytes, 9 are conducted ICSI and cultured blast cyst, and she can freeze 6 blast cysts and embryo transfer with hyaluronic acid rich medium. Then the total pay was it will be that 545,000 yen, and she has to pay 30% of them, and which will cost 163,500 yen. So she can save 381,500 yen because of health insurance, which is much higher than subsidy. And for the next example, 41 years old lady, unexplained, and she can pick up 3 oocytes, then IVF, and these oocytes are cultured to blast cyst, and she can freeze 1 blast cyst, then conduct ET with hyaluronic acid rich medium and assisted hatching. Then it will cost 380,000 Japanese yen, and she has to pay 30% of them, then 114,000 yen. Then she can save 266,000 yen under the health insurance. And as you can see here, patients with good overall response benefit more than poor responders by application of health insurance compared to this subsidy. But they have to pay, in addition to this art technique, fees for visit, medication, and ultrasonography, and blood test, and of course the 30%. So that even the poor responders still benefit from health insurance compared to subsidy, because all these costs are covered by health insurance. So for medication, most of the medication that has been used in ART is covered by the health insurance. For cause and trigger, we have used recombinant FSH, HMZ, and cranfin citrate and HCZ for ART as private practice, and also in non-ART covered by and already covered by the health insurance. Now we can use them both in ART and in non-ART, and both are covered by health insurance. And for these medication, GnRH agonist, antagonist, and progestin for PPOS, we have used for ART as private practice and now covered by health insurance. And of note, these two medications, aromatase inhibitor for unexplained infertility and PCOS, and metformin for PCOS with obesity and or insulin resistance. They are used as off-label use, both in non-ART and ART, but now they are permitted to use under health insurance system. For prevention of OHSS, we use cabergoline as off-label use in ART, but now are covered by health insurance. And for embryo transfer, estrogen progestin are of course permitted as in health insurance system. But for recurrent implantation failure, we have often used low-dose aspirin and glucocorticoid, and sometimes use heparin and tacrolimus. They are not permitted as health insurance and is now acknowledged as private practice. And although that most of the medication are we can use under the health insurance, but the indication in those are strictly limited in the health insurance system. For example, prescription of chromiphene citrate is limited to 5 days, although we used CC for around 10 days in mouse simulation protocol. So we have to change some modification in cost protocol. So how this policy change may affect the ART in our country. Although I am in university hospital, and the patient's characteristics are very unique. That is, that many of them have gynecological complications which require surgery, or systemic complications which require multidisciplinary approach. But still, we have experienced some changes in patients and cycles background in these several months. This is the number of patients in outpatient clinic. And as you can see here, the number of patients visited for the first time with our IVF clinic is 40% increase compared to the last year. And even in PGT clinic, it is not covered by health insurance. The number of patients increased by 53%. And this is the number of OPU cycles per month. And in April, the cycles was reduced, and in May, almost the same. But in June and July, the cycle number is increased by 25% and 53% respectively. And as a result, the total number of OPU cycle was increased about 13% in this year. It is not such remarkable. It is partly because of the reduction in April, which at that time, I expect that many patients are not ready for ART covered by health insurance. And also, it is partly because of the limit of the capacity of laboratory. But it is of note, the first OPU cycle, it means that the patient without a history of OPU is increased around 70% compared to the last year. And this is the characteristics of OPU cycles. And the age of the patients was almost 1 year younger compared to the last year. And the number of oocytes per cycle and number of frozen embryo per cycle is increased around 1.5 and 0.5 respectively. So among OPU cycles in this year, the ratio of insurance cycles to total cycle is rapidly increasing. And in July, it reaches 78%. And among the cycles not covered by health insurance, 45% was PZT cycle. And the 33% was because of age, and 22% was for fertility preservation. So although we just only have several months of experience in insurance, I expect it is to promote couples to be interested in ART at relatively young age. And the one reason may be that, of course, the reduction in the economic burden of the couples, especially for young couples with good ovarian response, but often feel difficulties to afford ART. Let's take a look at this 34-year lady, for example. So she has to pay ART technique plus fees for visit, etc. Then total approximately Japanese yen of 750,000 yen. And in subsidy era, she has to pay 450,000 yen. But now she has to pay 30% of total cost. Then she has to pay 250,000 yen. And another reason should be that the lowering the psychological barriers to undergo ART. So once the health insurance, ART is covered by national health insurance, it is acknowledged as unusual medical care, not as an unusual extraordinary care only for a limited population. And importantly, it is not only by couple themselves, but also by those surrounding the couple. Patients often told me that we did not dare to have a child by receiving such a special medical care. Now that it becomes a usual care, we are interested in undergoing ART. And some patients told me that it becomes easier to tell our parents or colleagues or friends that we undergo ART, since we ourselves can feel that we are receiving a usual care. In addition, bosses and colleagues who previously didn't know much about infertility appreciate our situation receiving ART. So they can feel much easier to undergo ART. But there are some concerns to address. One is regarding add-ons. This is the list of add-ons conducted in Japan. The add-ons in blue font are covered by health insurance, as I told you. But orange font are acknowledged, admitted as advanced medical care. So that's simultaneously conducted with the blue basic technique. And the PGTA and the immunological tests and treatments shown in red font are acknowledged as private practice. So the problem is that increasing economic burden for couples who needs care not allowed as advanced medical care, shown in orange font, compared to the era with subsidy. Let's go back to the 34 years old lady's example. If she wants to do basic technique plus time lapse and error, it costs this basic payment plus cost of time lapse and in error. So she has to pay totally 324 and 500 yen. So it is much lower than the subsidy era. But if she wants to undergo PGTA, for example, for 4 blasts, she has to pay all the costs for this basic technique, 100%, plus costs for PGTA. So total this amount, and it is much higher than the subsidy area. And another concern would be that the art registry. Our art registry is covered almost all, maybe over the 99% of the ART cycles in Japan, because the patients couldn't apply subsidy without art registry number for each ART cycle. But now the health insurance system requires clinic to register the patients. However, who check whether all the cycles are appropriately registered? And also the clinics who chose to provide ART only at private practice do not need to follow the requirement by the health insurance system. So we have to discuss how to ensure the quality of this art registry. In conclusion, we expect that the application of health insurance to ART will promote access to ART, although there is some room for improvement. The most critical effect of this policy change, in my opinion, would be that it makes all the people, not only couples seeking infertility treatment, interested in reproductive health, and evokes discussion in a society on various problems that may affect women's health. Thank you for your kind attention.
Thank you, Dr. Harada, for a very interesting presentation. We can see there are a lot of particularities on the IVF journey and insurance in Japan. Many times you have to change the protocol to fit the insurance system. So it was very interesting. Thank you very much for all your inputs.